Hey you guys. So today's Monday the 22nd, and my throat's still a little bit raspy. I don't know if I'm getting a cold on top of everything else, but most likely. Um, so there really isn't any news. Um, I started first thing this morning and I called the GYN surgeon that was in the operating room and looked at the mass, and he belongs to a group that apparently I was dismissed from many years ago. I actually was a member of their group in my early 20s, and because of a bill not being paid, I was dismissed. And I don't even know when that was, but they just looked me up and said that I was dismissed. So I called my bariatric surgeon and let her know. And so she's got two other surgeons in mind that she's going to refer me to. And so that supposedly got done this afternoon, and I still haven't gotten a call yet from their office. So it's just a waiting game. I did want to say, because I'm sitting here kind of driving myself a little crazy. So normally I can look at my medical record, but I don't really have access to a computer right now since I'm on medical leave. So I went out and had some medical charts printed. So looks like they did do some pelvic washings, and it came back negative for malignant cells, so that's good. And then I'll just read you what the operative report said. I don't mind sharing this information. So post-operative diagnosis is giant paratubular cyst on the left fallopian tube. So using word giant and huge is a little scary. So intraoperative findings: a giant cystic fluid-filled structure was seen immediately upon laparoscopy, initially thought to be an enlarged bladder. However, further manipulation demonstrated to be coming off of the left fallopian tube, extends from the pelvis all the way up to the level of the liver. Intraoperative consultation obtained by Dr. Gill of OB, who felt that the cyst was grossly benign in appearance but would warrant further workup prior to excision. For this reason, planned bariatric procedure was aborted. So the rest is, the specifics as far as placing a catheter. I'll just skim this part. At first glance, it appeared to be very enlarged bladder. For this reason, urology was called and recommended in that scenario of evidence of neurogenic bladder to place Foley catheter, and that she would be evaluated further as an outpatient. However, as the large sac-like structure still had significant amount of fluid in this, which did not make sense with the bladder, which should be completely decompressed by the Foley catheter, I inserted additional instruments to manipulate this structure and placed the patient in reversed Trendelenburg position to examine the pelvis. At this point, the mass could clearly be seen emanating from the left fallopian tube. Therefore, it was a left paratubular cyst, and at this point, GYN consultation was abstained. Let's see. Dr. Gill was willing to see the patient in consultation as an outpatient and to plan her surgery as soon as possible, as she does have an IVC filter in place, which is retrievable, which should ideally be removed within 30 days of placement. It was placed October 5th. So we're kind of on a time crunch there. So that's that. I was hoping to see pictures, but not today. I didn't get to see him today. So I've looked up pictures of cysts online, but everyone looks a little bit different. So as far as like my mood, I think depression is definitely setting in. I feel like I'm going stir crazy a little bit, and I went to a movie with my mom and my aunt yesterday, which was nice, and I'm overwhelmed in many ways. The outpouring of support from you guys has been amazing, and I mean, I'm reading it and I'm trying to take it in, but I haven't really done much responding because I'm kind of scared to start the floodgates a little bit. I'm just kind of holding it right here. I don't know what I'm waiting for, I guess, but I just kind of want some answers because the what ifs are driving me kind of crazy. And so yeah, it's there's not a lot to update. My incisions are still very sore. I've been icing them and taking pain medicine and trying to take it easy, which I don't want to do. I just want to leave my body. I just want to get out away from myself. And I just feel sad because I thought things were going to be different, and now I don't know about my future, you know? Like, I had this goal in mind, and now it's like it's not there. And it just feels like something has been taken away a little bit. So I'm going to continue to rest. I did start journaling today about what happened. And I haven't been watching your guys' updates because literally anything that reminds me of me and my surgery and my journey just devastates me. And I just feel like in shock. So as far as online goes, I'm just watching makeup videos and looking at Pinterest for nail polish, and because I don't want to think about weight loss, I don't want to think about gastric bypass or weight loss surgery or recipes or any of that stuff that's normally on my mind. I just want to think about happy things or material things, like, you know. So that's it for now. As soon as I get any information, I'll let you guys know, and please know I'll get back to you guys once I start feeling better. But I just feel so strange, and obviously, you know, this isn't me, my normal self. I just feel yeah. So but okay, I'm sorry. I'm just out of it. I'm really out of it. So I'm going to take some more pain medicine and ice my side, and try and relax. So thank you guys again, and I will update soon. Bye.